I would like to say something about the indigent population that's migrating into Somerville County, particularly from Hood County. The other hospitals around us have shored up that problem a little bit by requiring a medical screening exam be done on people who come to their emergency room to see if they're truly emergent or not. We don't do that. We've talked seriously about doing that, and we will be shortly instituting that, and I think that will cut down a great deal on the amount of indigent care that comes here from Hood County, because they require it there. They go into the emergency room there, they're asked to pay if they're not truly an emergency. They come here, they're not asked to pay. There's no questions asked. Service is rendered. Once we instituted that policy in our emergency room where they're required to go through a medical screening exam, a lot of those people are going to disappear, because most of them are not medical emergencies. And when they present to our emergency room and they're screened by a physician, and the physician says, "I'm sorry, ma'am, we're sorry you're not an emergency. Now we will see you now, but you have to pay this much money." Those people will go away. And so I think that problem is being addressed in an entirely different way by the medical staff. And hopefully that will help along those lines. Does that answer your question?
Yes, thank you.
Will that be a requirement of the hospital district? I mean, how is that plan going to be implemented? Thank you. I want to speak to the indigent health care right now. For Somerville County, 8% has to be set aside to take care of indigents for Somerville County. Only 3 to 4% for the last 5 years has actually been used for Somerville County indigents because of the policies to allow them to become indigent. So it would just seem logic, common sense, to require Hood County indigents. I mean, they can go to Hood County and apply for indigent. Why do we allow them to just, why aren't those things in place in ER? Or when will they be in place?
Well, Dr. Davis, that's in process right now. The medical staff has to set up those policies because they address clinical situations. Management would not be involved in that. The medical staff is. We're assisting them to develop clinical policies to establish medical screening criteria that our staff would then utilize to go off.
If a physician sees somebody here, like Dr. Davis, and screens for whether they can pay or not, or
screen for whether they're a true emergency or not.
Yeah. Why would they send them to ER for lab tests and things that they couldn't pay for? I mean, why wouldn't they?
They're not screening them for if they're able to pay or not. They're screening them to see if it's a true emergency. That's what he's saying.
Yeah.
And that's one thing in our emergency room, we cannot ask how they're going to pay. We cannot even address anything about payment until we're finished under the current circumstances. So anybody can walk into our emergency room and be seen, no questions asked.
I understand that.
And so, not only the poor but the rich, anybody can just walk into our emergency room any day, hour, night, and be seen.